My name is Alex Tang. I teach medical student in the Monash medical school in Malaysia. And for the last 1 year, I've been teaching this clinical course online. The students are not allowed into the wards, so they have no exposure to patients at all. And medical course being a clinical course depend heavily on getting in contact with a patient. So one of the things I have been thinking about is the ethical consideration of conducting a professional course, a course like medicine online. Is there any ethical consideration? Should we stop the course at all? So what I'm doing is do a conceptual study. Just to think through last year, did we do right by our students? Okay, let me share my screen. We're going to talk about Zoombies. Okay, not zombies, because I guess we are in zombies by our time on Zoom. So this will be a reflection on a year of teaching clinical pediatrics online. Now, the pediatric program in Monash University, Malaysia is the same as Monash University in Australia. We are just a branch campus. So I teach many in the year 4 pediatric rotation, which actually involve 8 weeks. Okay, where we have a first week is usually lectures, where we do it on campus, and then throughout the week we will have each group will have at least 2 bedside teaching. It means teaching at the bedside with the patient and the parents in the hospital wards. Then we do have a small group tutorial or case-based learning on the campus, which is in smaller group. We try to learn about the macro part of pediatrics. The large group tutorials will be on campus, where it's a topical study. Then we already have 2 courses online for the students for the 2 semesters. And we have the access to the LMS Moodle, where we upload our resources, past lectures, reading materials. And we also have a self-directed program where the students have to can help themselves and direct their own learning. And then we will have our assessment, both summative and formative. So this is what we have been doing all these years before the lockdown. Then came the lockdown, okay, where we all went online. Within 2 weeks, everything is online. So it was a big challenge. And we realized that there are certain factors that affects online learning. Things like self-directed learning, which is a very important factor. But the advantage of online learning is that there is learners' control. Learners have control of their time and what they learn, when, how, and where. But of course, it implies that you must have computer and internet literacy, efficacy, and online communication efficacy. That means knowing how to use online. And more important is that there must be motivation for learning, which are all key factors. Even if you are doing on face-to-face, these are key factors. And self-directed learning, I believe, is a key. And we have in medical education moved, and I am happy to say that we have moved successfully into adult learning. And without self-directed learning, where students are encouraged to be self-directed in their learning, what they want to know, how they want to know, and why they want to know, and how they want to retain what they know. Now, even before we went online, studies done in 2 campuses in Malaysia actually shows that they are, in some ways, students are ready to go online, are ready. Only thing is the lecturers are not. So you find that female students are more ready than male, degrees students are more ready to diploma students, but many of them do not want to do totally online. They don't mind part of it online. And the biggest challenge for students is internet connectivity and limited broadband data, which is a big issue as we talk about Zoom. Okay, Monash usually use only Zoom, not Google Meet or Lark. Okay, and we realize that there are limitations to Zoom. Okay, Zoom is that the number of students are able to participate. Yeah, we can have big webinar and all that, but it will not be effective. We would prefer small enough group for personal interaction. How long is a Zoom session? Okay, Zoom can kill, literally. And technical faults of the Zoom session. So we do not want to have waste a lot of time getting stuck with the Zoom session. And of course, the important thing is internet connectivity and broadband data. And initially, you find that students have problem getting enough data plan, getting the right data plan. So most of the time we have the screen off. But recently we find that more and more students are able to get enough data plan and we are able to see their face. So let me reflect on some of the ethical questions that I've been asking. Will the students be handicapped by the lack of clinical exposure in the ward? Okay, as I said, with the professional course where we need hand-on. Okay, they need to talk to the patient, talk to the parents, touch the patient, do the examination, and read up on their conditions. Okay, so would that be effective? Are the students learning? Okay, we hope that the students are learning, but are they in fact learning? Are we forming and transforming competent, safe doctors? And I think that's the whole aim of a medical education, not just to give them the union card and the MBBS or the MD, but to make sure they are competent doctors and to make sure they are safe doctors before we let them loose on the world. So with the online learning, the first question I'm concerned about is, are the students handicapped by the lack of clinical exposure? My initial thinking was that, yes, they will be severely handicapped. But if I look at it in a larger picture, in the fact that they only spend maybe 5 or 6 years in the college, in the medical program, but they will be spending the next 40 to 50 years in clinical practice where they will be in touch and in contact with patients. So in a way, it doesn't make that great a difference. Maybe, yes, it introduced them into the complicated and the wonderful world of patient care, the wards. Okay, it let them see patient as real person, not digital data. But this is the beginning of the journey, and they will make up for it. Okay, I'm often reminded by premature babies or babies who have failure to thrive. They are not growing. But with the adequate nurturing and help later on, they actually catch up. And I believe that when the pandemic is over and when the students get into the ward as house officer and as medical officers and specialists, they will have more than enough time to catch up. And I don't believe that they will be so very handicapped by the lack of clinical exposure in the ward. In fact, as I think deeper into it, I believe that this time is actually good for them to build a strong foundation in theory, which we found that in previous batch of students who have put a lot of time in the ward, they are so distracted by what is happening in the ward that they do not build a good theoretical foundation. Well, we can help them to give them a taste of what it's like in the ward by having stimulated patients. That means people acting as patients, which we are doing, to have detailed case studies, okay, and to share our clinical experience. All these years in our ward, we bring out as stories, and the students enjoy that. So that is one way I try to limit the handicap from exposure to the ward. And the students are learning. Well, you'll be surprised or to be reminded, or you will not be surprised that our students are actually digital citizens. They are no longer digital native. They are born in the digital. So they move in the digital world freely more than we are able to. So for them, adapting to online learning is nothing, but they need to be guided. And that's why we need to rethink our way of teaching. We cannot go by our standard lectures and all that, but get them to be exposed, get them to do things, and they get them to build things, and get them to apply. And we can actually do critical learning on Zoom. And important is to keep motivating them to do the right thing. And are we forming and transforming safe, competent doctors? Well, medical education is unique. The whole history of medical education has always been the apprentice system. Okay, we transmit and by modeling. That's why the lecturers are so important, that they are clinicians themselves, that they are in the ward and they model. They model to the students who go on grand rounds with them, how they treat the patient, how they speak to the parents, and how they diagnose and plan the management plan and carry it out. It's all learning by modeling to see how it's done. Well, we are not in the ward. Can we do that? I believe that we can. I believe that students learn on how we treat them on Zoom itself, how we speak to them, how we act, how our facial expressions, our gesture. These are important things for students to model. And can we transmit values? I believe we can too. It's how we talk and the topic we discuss and what are our feelings. Okay, so instead of giving a formal lecture or formal discussion, we go into a discussion with them. We go into a study with them, but we show our real self. We review our thoughts, our values, and how we feel it should be done. And these things are all caught rather than taught. So are we doing okay? I believe so. I believe that the medical zombies are here, but they should be okay. And I believe that we are not unethical to teach clinical medicine online. So here, thank you for listening and thank you for your time.